Hi there, I'm Dr. Anthony Dakpallah, your radiologist. Now let me guess. If I either said this or you've heard someone say it before, I don't want that scan. I heard X-rays can cause cancer. Does that sound similar or familiar? I get it. The word radiation sounds like something like a science fiction movie. Dangerous, invisible, and risky. But here's the truth, and today we are breaking it all down in plain, simple language. What is radiation? How much is it in your scan? And should you really be worried? Let's separate facts from the fears. What is radiation in imaging? Radiation is just energy. That's it. Light is radiation. Radio waves is radiation. Heat from your microwave, yes, that's also radiation. But the one that people are quite worried about is a specific type, which is the ionizing radiation. The kind that can affect cells and the kind that is used in X-rays and CT scans, but is used in tiny and controlled amounts. We don't just blast people, we just use enough to see what we need to see. Do all scans use radiation? No. So X-rays and CT scans and mammograms use radiation. MRI scans, ultrasound scans do not use radiation. They use a different technology. So if you are doing an MRI scan or an ultrasound, no radiation at all. We only use radiation when we truly need it. So, can radiation from a scan cause cancer? Here is the honest answer. Technically, yes, but extremely unlikely at the doses we use medical imaging. A single X-ray or CT scan is not the same as working in a nuclear power plant or being exposed every day. We are talking about small purposeful doses, not random exposure. And in most cases, the benefits of finding something serious far outweighs the tiny risk. Let's talk numbers, but let's keep it simple. So, you have a chest X-ray. That's equal to what we call in 0.1 millisieverts. Millisieverts is what we measure radiation in. And this is equivalent to 3 days of you just walking about doing your normal thing every day. Head CT scan is equivalent to 2 millisieverts, and this equivalent to 8 months of background radiation. I'll explain background radiation after this. Abdominal CT scan is about 8 millisieverts, and this about 3 years of natural exposure. So just living on Earth, the radiation you get every year is 2.4 millisieverts. So you are getting this from the sun, the soil, water, life, basically. Yes, so you are already getting exposed to radiation on a daily basis. And right now you are being exposed to radiation. You are just adding a little more and only when it matters. So wait, what is background radiation? You heard me talking about background radiation. So even if you've never had a scan, you are still getting exposed to radiation from the sun, the ground, the air you breathe, the food you eat. Yes, that banana you are eating right now, you are exposed to radiation. This is called natural background radiation, and we all live with it. So when we talk about radiation from a scan, it's just a tiny bump on top of what nature already gives you. So let's bust the myths here, okay? One X-ray or CT scan will give you cancer. The truth is that a single scan, one scan, shouldn't give you cancer. That dose is too small. And the scan may help detect a serious condition early, like a tumor, blood in your brain, or stroke. Sorry, not your brain, but bleeding in the brain and stroke. The risk of not scanning is usually higher than doing the scan to find out that you have these things. Why do CT scans use more radiation than X-ray? This is simple. And so a CT scan takes lots of X-ray pictures from different angles, and then it puts it together to form somewhat like a 3D image. So yes, you are exposed to more radiation, but that's because you are getting a better and deeper view of whatever is happening in your body. And guess what? Modern CT scans use way less radiation than the older ones, and we constantly fine-tune doses to keep it as low as possible. So what about children? Is radiation more dangerous for them? Yeah, for children, they are more sensitive to radiation because their bodies are still developing, and that's why we as radiologists and radiographers try doing other scans if that can find the problem. So maybe ultrasound, MRI. We also use child-size doses, and then we avoid repeat scans unless we absolutely must do the scan. We also follow certain principles known as the ALARA principle, which means ALARA, that's ALARA, which means as low as reasonably achievable. Always scanning smart, especially with kids. The next myth I came across is that children should never get CT scans or X-rays. And the truth is that they can. When it is necessary, we need to do CTs or X-rays for children. We are just extra careful that we don't do unnecessary tests for them. We scan only when needed and with the lowest dose, and adjust everything for the size and age of the child. So how do we keep you safe from too much radiation? This is what we, the radiologists, do best. So we use the lowest possible dose, and then we scan only when medically needed. We avoid unnecessary repeat scans. We track your imaging history when we can to see if probably there was something in the previous image that would help us with our diagnosis. We adjust the doses for children and smaller adults, and then we use shielding or protection when appropriate. So their testes and other parts are shielded. We don't just scan for fun. Every scan is done with purpose and care. So the next myth was that doctors don't care how many scans I've had. And the truth is that we do care. Okay, we keep track from your history. Sometimes you may come with your old scans and then we may have a look at it, and then it will help us with what to do next. So we think twice before repeating the scans, and then we'll often choose a radiation-free option like ultrasound or MRI when it can still give us answers. So, and just know that your safety is part of our decision making. So it's an integral part. So quick takeaways. Here's what you need to remember. Radiation is real, right? But medical radiation is it's only in a small dose. One scan won't give you cancer, and we scan only when the benefits outweigh the risk. MRI and ultrasound use zero radiation, and we always aim to use the lowest dose possible. So let's answer the big question: do X-rays and CT scans cause cancer? Not at the doses we use in medicine. Yes, we are cautious, but these scans are also lifesavers. If your doctor recommends one, it's because they are looking for something important and they want to get it right. In the next episode, we'll shift gears and we'll talk about breast cancer screening, because we are in September and October is just around the corner. We'll break down mammograms, and when we'll talk about when to do them, why they matter, and how they help save lives. So this to encourage you to patronize the mammograms during the peak October period, where there will be a lot of screening going on in various hospitals. So choose the hospital you like, and then please, if you qualify, you can go for your mammogram screening. So if you're a woman over 40 or love somebody who is, don't miss it. Like, share, and subscribe. And drop any questions you've had about radiation or scans in the comment section. See you in the next episode.